Garcia, one of the sports knee and shoulder surgeons here. Today we're going to show a really good video testimonial of a patient. She's 41 years old. She had a unique injury where she had recurrent dislocations that ended up developing arthritis. In addition, she had significant instability of her knee. So this is a tough combination because even with some of the new technology we have, such as a partial knee replacement or a patellofemoral replacement, which is a little bit more of a unique surgery, that still may not fully work because even though it does help some of those parameters, you can still dislocate your knee. And so there are a few options, and the least invasive option is a newer technique called an MQTFL. It's something we can actually do with patellofemoral replacements, where we attach a ligament to the quad tendon, and essentially it's a hybrid technique similar to an MPFL, but using the quad, and it's for patellofemoral replacements. So we're able to do this sort of unique combination of an MQTFL and a patellofemoral replacement to stabilize her knee and take away her pain. And you can see she was quite happy, so hopefully you enjoy the testimonial. Thanks.
So right before this last dislocation, my knee had slowly been deteriorating for years. There was a lot of clicking and popping, a lot of pain. I assumed and was confirmed it was a lot of bone on bone, so it was really uncomfortable. When it dislocated, obviously it was extremely painful just because it had also fractured, and the swelling was really painful, and I lost a lot of range of motion and really wasn't able or confident to move it because I knew it could dislocate. And this last dislocation, I mean, it was completely off track. You could see it comparing to my other leg. So essentially it was no longer functional and it was absolutely not stable. It's now it's in a place where it's strong again. It's very stable. I slipped the other day and I wasn't scared about anything happening, which I don't think I've ever experienced that most of my life. So there's no pain. There's still, of course, sounds in there, but that is normal, and of course much better than the way it was before, which is completely unstable. So this has exceeded my expectations because obviously this surgery worked. Also, Dr. Garcia is an artist, and my scar is absolutely beautiful. I can't even believe that I had the surgery such a few months ago. It's healed beautifully. And of course, I could never have expected to be pain-free and have a stable knee. So what that also did for me is cure my mental load. That I didn't even realize how mentally draining and how triggered my nervous system was all of these years by constantly being, fight or flight or on defense or scared of slipping. I don't have that same fear anymore. I don't think I could have ever predicted that part of it, and that's been obviously life-changing and is a burden off of my shoulders. And would I recommend the surgery? I mean, absolutely. In fact, when before this surgery, there really weren't many options. I have many friends that I grew up with that we have had many dislocations together over the years that are older now and had different surgery options, and they were not as successful as my surgery. Anyone that has, frequent patella or kneecap dislocations can absolutely understand what this life and this pain is like. And so I would definitely recommend it, and I'm sure they'd have no problem saying that they would have this surgery to be able to cure that constant state of fear and, of course, the pain and having a stable knee again.
Good. And you've never been able to do that in a long time, right?
No, not without pain.
Awesome.
Color, ligament